Okay, all right, we are online. Guys, I am so sorry if you got kicked off, but it's one of those things. But anyways, I'm fluffing my hair. We're going to take the next 15 minutes to talk about hair implants. And hair implants, it's really important because it's a great option for individuals who have completely lost their follicle, women who are suffering from female pattern baldness, men who are suffering from male pattern baldness. It is really, really important, or some other kind of androgenetic like alopecia, or some other type of internal follicular alopecia where your follicle has not only just malfunctioned, your follicle has stopped functioning. So I apologize for all the technical difficulties for people who got kicked offline, but we're going to go right into implants because I think it's crucial. Okay, what are implants? Or it's surgery. It is surgery, and I think it's important for you to keep that in mind, because when you have implants, you have to um, see a dermatologist, surgeon, or surgeon. It's not a trichologist unless they're a surgeon or a dermatologist. To be someone that, and we partner with these individuals, it's going to be someone who can actually take your follicles from the back of the head, your own follicles, like wherever you have, they find a donor section on your head, and they take those follicles and they remove them from that particular area, and then they move them to their technician separates them. They take the follicular unit, she gives it to the technician, she separates that, and then the surgeon actually insert those into another section of the hair, that whole follicle with the hair, and they take that section and implant it or transplant it into that section. Now, some people have had questions. Some of the questions will be, is this painful? Well, no, because they do give you an opportunity. You're awake, but they will take the area and they make sure that they are deadening that area so that you will not feel it. You actually, some people are sitting there reading magazines while it's being done. So it does not, you don't feel it. Thing that we have questions about is, will that hair fall out afterwards? Well, that hair section where they're putting the new site where they put the follicle and the hair, it's going to take on the same that it had when it was in the donor area. So it's going to shed and grow, rest, shed, grow. It's going to continue. So it will, if it sheds off initially, then that's because that was time for that particular follicle to shed, but it will grow back. It grows and responds the same as it did when it was in the other section. And that's why sometimes your doctor will tell you that with implants, you may lose the hair at first and then it'll grow back. And they tell you, give yourself 12 weeks to 6 months to get this hair to where you can see the nice fuzz. Will it grow to the length, or will you just have a fuzz? That's another question. It will take on the same length that it will take on in that donor area. So if it's in the back of the head and you normally have length to the back of your head, that it will take on that length. If it's hairline hair moved around, it'll take on that length. But usually it's going to be in the terminal areas, like we call the terminal follicles, where those are follicles where have hairs that grow 2, 4, or 6 years. So they can anywhere from 12 to 24 and beyond length, and it's all genetically linked. So you can have hair with length in that area. So those are the sections. What's the recovery time, which is another question we have. The recovery time is pretty quick. And I'm going to talk a little bit about that. I'm kind of put a pin in that on recovery time. And let me tell you something that I have patients that I see do. Whenever a patient is a good candidate for implants, and I do recommend them to some patients, whenever they're a good candidate, what I tend to do is tell them, we need to do this pre-care to get your scalp ready, because when you are implanting hair into a section, when you're removing it from a section, that scalp around that section needs to be healthy. Because if it's not healthy, then the healing time after the surgery is a lot longer. And this is just from experience and working with patients who've had these particular surgeries. And also it's from um, knowing the skin and studying the scalp as skin. It has to heal. And when you are removing that follicle, you're actually creating, you're going into the dermis. So if you're going into the dermis, there's blood vessels, there's all these things. So this is surgery. This is, some wouldn't call it major surgery, but it's major to you, surgery. So you do have to be careful. So you want to make sure you create a clean, acidic, stimulated, hydrated environment for a minimum 12 weeks prior to getting your implants. So that means you want to shampoo your scalp and hair daily. If you are a male, female with hair in other areas, at least twice a week, same thing. And you want to use a shampoo that has the pH of your hair and scalp, which is 4.5 to 5.5. Look on the back of the bottle and find that little number. And then you want to make sure that you are not doing any things like overheated dryers, letting your scalp dry under cool dryers to lock in any type of conditioners or treatments. And I'm going to recommend a scalp treatment level 1 or level 3 if you have some itching, and put under cool dry, and then use minimum amount of heated dryers, making sure that depending on your scalp condition, you just minimize the amount of heat. And I'm trying to rush through this a little bit, but my recommendation, if you're having any scalp itch, flake, or tenderness, and it's chronic, instead of trying to just create that environment, see a trichologist, one that uses a handheld microscope, and they can put you on a program, a 12-week program that'll get you ready for your implants. Now, other than that, I mentioned the clean environment, shampooing once a week. If you're male and have hair, or a female that has very short hair, and the reason is because all the debris is going straight to your scalp as it is in the air, so you want to shampoo often. If you a female or someone with longer hair, you can shampoo twice a week, every 3 days, excuse me, and shampoo twice a week, because your hair is holding some of that debris, so it's not getting to your scalp. And the scalp doesn't really actually get dirty from its own shedding of skin for about 3 days. So you're okay to do twice a week, every 3 days. So that was my reason. The other thing is you have to keep in mind that when you are going to do implants, you got the clean, acidic pH of the shampoo, clarifying. You want it to be at a pure state. Always want to get your scalp clean, and your hair as well. You want to create a hydrated environment. I mentioned the heated dryers. That's the biggest way to have a dehydrated environment on your scalp. With men and women, you have to be careful to make sure that you do not have a dirty scalp. Like if you're sweating, playing ball, or working out, whatever you're doing, you need to make sure that you are actually shampooing your hair on a regular basis, because that can create a dry, dehydrated environment as well. So that's crucial. Okay, clean, acidic, stimulated, hydrated environment. That's important. All right, guys. All right, the other piece with implants is give it time to grow your hair, that follicle. Give that time, because if you give it time, then you're going to have hair. Once it starts to grow, you'll have hair growing with these hair implants. It will grow at least a ½ inch every 4 to 8 weeks. And so once it starts to grow, you got to give it a chance to get into its growth cycle, go through the shedding. It will grow. So it'll grow normal. So that's the cool thing. How do you care for it? That's another big question. You shampoo just like you would your hair and scalp. Remember, guys, this is your hair. Your hair, scalp. Implants is a surgical procedure. You have to take care of your scalp. You have to take care of your hair so that you can continue to have your hair and have a healthy scalp. And then you won't end up losing that hair again for other reasons. So if your follicle has stopped functioning, you are a good candidate possibly for an implant. See a trichologist, uses a handheld microscope, and that trichologist will help partner you with a surgical dermatologist or a surgeon who does the implants. And that way you will have an opportunity to have the relationship with the trichologist and with the surgeon so that you can have the best results possible. Please email me, Lisa at lisaakbari.com, if you have any questions about hair implants and transplants, because I want to help you. Or you can go to my website at lisaakbari.com and you will be able to have a cyber consultation with me one-on-one. And some of these sessions that we have on the radio and online is really hard right now because I'm trying to get the most frequent asked questions in. But I just wanted to talk to you about it. We've had some technical difficulties today online, but guys, I love you so much. I'm so happy to be your hair doctor. I'm a trichologist. This is my way of giving back. So if you need any help about hair transplant or implants or anything relating to your hair and scalp, please email me, Lisa at lisaakbari.com, or you can call my institute. If you're not online, you can call my institute and set up a phone appointment. We call it cyber counseling phone appointment, and that is 901-380-4445. Thank you guys so much. I love you so much. To God be the glory in Jesus. I'll see you next week right here in the WDA studios in iHeartRadio. So don't forget to subscribe to my YouTube page. Follow me on Twitter. Like me on Facebook. You know, all that good jazz. Thank you guys so much. I love you. And I'll see you next week right here on Ask the Hair Doctor.